Tomorrow, the federal government is going to reset its plan for the country in a speech from the throne. Then, as David Cochrane explains, something more unusual will happen.
There have been agreements and differences.
In a normal year, the Governor General reads the speech from the throne and gets the last word. But with Canada facing a second wave, there will be a second speech. Justin Trudeau will address the nation Wednesday night, speaking about the urgency of fighting COVID-19. The Prime Minister keen to be the prime messenger for his COVID recovery plan. Sources close to the Prime Minister insist this has nothing to do with Julie Payette's controversies and everything to do with getting the virus under control. Trudeau will also reinforce the broad themes of the throne speech, controlling COVID, supporting Canadians and businesses financially, and rebuilding for the long term. But Trudeau is facing a minority parliament and the opposition has demands.
Extend CERB, put in place a new program that doesn't cut the help they receive, and make sure every Canadian has access to paid sick leave. That's what we're asking for.
There will be measures along those lines, sources say, along with more money for long-term care to address failures that led to most of the COVID deaths in Canada. There's also money for childcare to get parents, especially women, back to work.
Our government remains vigilant in preparing for the possibility of a resurgence.
The speech will speak to the long term, but there will be an urgent focus on the health crisis of the moment. Measures to boost testing, continued investments in vaccine, stockpiling options for a way out.
Canada now has secured access to a guaranteed minimum of 154 million doses and up to 262 million doses of potential vaccines.
But those vaccines aren't ready yet, so the speech and the Prime Minister's address will brace Canadians for the long haul. As cases spike and testing lines grow, life without COVID is a long way off. David Cochrane, CBC News, Ottawa.